Yeah, there's Amanda, look, on there, nice and close up. That's Amanda Rawlings, right? She's the improvement manager of NHS Improvement. Everything's we're all very improvement. This all, darling, we're improving everything this morning. We're even improving improvement. It's so good. But actually, she's a pharmacist, aren't you?
I am, yeah.
Yeah, and I've just been sitting in the back of her session. She had a really good session on the 10 top tips for using pharmacy. It's easy for me to say, the 10 top tips for improving pharmacy. To get people moving through the system. But I mean, seriously, for a moment, you don't kind of think of the role of pharmacy, do you? In that sort of whole system experience.
We don't, but quite often pharmacy and TTOs are primary reason.
Yeah, okay. TTOs for people who won't know what a TTO is. Just
take home discharge medicines for patients going home. Quite often are cited as a reason why patients are late going home.
How many times is it you see little old ladies sitting next to the bed or in the patient's discharge lounge saying, "I'm waiting for my pills to come up from pharmacy"?
It happened to my father-in-law last
really?
week.
Yes, really. Good. Yes. Oh, what have you
Not
done?
in my trust.
What have you done about it? Yeah. So, okay, you did a fantastic set of slides presentation for us this morning. 10 top tips. I guess the slides will be available somewhere at the ECIST if they dig around them. Just you can't go through the 10. We haven't got time, and you can't remember what they are anyway. So, but just give us 3 or 4 top line ones.
Okay, so part of it is about the 5 principles, which is about don't do work that you don't need to, so don't do discharge dispensing unless you really need to. If you do need to do it, then keep the work out of the dispensary, because actually once it gets into the dispensary, it really starts to clog up. So it's about being near to the patients, getting the pharmacy team near to the patients. And then it's about when you do need to do it, just really, really think about your processes and condense that time, which you can do by keeping it close to the patient. You can use alternatives like overlabeled medicines, use TTO packs, use non-medical prescribers to do the prescribing, because what we found...
Yeah, that's right interesting, isn't it? I was at a conference just recently. That's quite new. A lot of people are a bit nervous about it.
It's not that new.
No?
Some trusts have actually implemented quite systematically.
I'm talking since 1946.
Okay.
It's new. Yeah. But it's. I thought that was a great idea. But of course, the other thing is that I noticed you were talking about this morning was that if people bring medicines in with them, let them use them. I mean, there was a time when the hospital said, "Oh no, you can't. We've got to prescribe the medicine," because there is a risk issue there, isn't there? A risk assessment.
Not necessarily. I mean, there are ways to manage that, but also we shouldn't be too risk averse, and we should also allow patients, when they come in, if they say they've got a supply of their own medicines at home, to let them use them. When they go home, don't think that we need to.
And they've been taking them perfectly adequately at home.
Absolutely.
Why do we suddenly have to go in and do it for them? Yeah. I think it was a really interesting insight into a sort of a little niche part of the patient's experience in hospital that we don't shine the light on enough, I think. It was a really good session. Amanda, thank you very much. So you can see, we'll get Amanda's slides put up on the ECIST website, I think, or NHS Improvement somewhere. On a website, okay. Dr. Google will help you, and there's more to come. Thanks. Okay. And of course, you've been kind enough to put some of your excellent work on the Academy, on the fab stuff.
I have. Well, I've been working with colleagues around the country, and they have submitted some of the excellent work that they've done included as examples.
So a lot of it's on there. That's a leaflet that you can get and probably download from NHS Improvement. But a lot easier. Go to the Academy of Fab Stuff, because it's all there.
It is.
You've got some more coming up.
We should hopefully have some more coming next week.
Yeah, excellent. Thank you very much.